Cheryl's our nursing unit manager on Ward 4B at the Calvary Mater, and she's unable to be with us today. Unfortunately, she's in Hawaii, so I'm presenting on her behalf, and Mel and Leah are here today. We have many long-term staff working on Ward 4B at the Calvary Mater, some with up to 40 years service, and we say the Mater way when we do things. Our way was the only way, and change was also always viewed as bad. Now that EOC has been successfully implemented, the staff are well versed with EOC methodology and are happy to be involved. The staff can make the change collectively and collaboratively the way they feel will work best, which makes the change sustainable. This is just the entrance to our ward at the Calvary Mater, and 4B is a 30-bed surgical unit with about 43 staff, and it's a fairly newish ward. It's only 7 years old. They refurbished. These are just three of our facilitators, Mel, Ellie and Leah. Vicki and myself are the other two, and we're very well supported by Cheryl, who's our nursing unit manager, and she's played an instrumental effect on the success of the EOC on Ward 4B, and without her it wouldn't be as successful as what it is. Our first EOC project was long and difficult, but ultimately very successful and now firmly embedded. Part of our first project involved introducing bedside handover. Prior to the implementation, on average, unfortunately, we had 5 PCA dosing error incidents per month. Our ward now has no errors recorded at all, and this is due to the change in the process and therefore change in the culture that we've had within the ward. This is now the way that we do things. Through EOC, staff improved work practices, changed the way we did things, and therefore changed the culture. In 2013, the staff satisfaction survey was conducted with these results. Staff feel in the last 2 years the service has made significant improvements. That they also say that they feel that they have a say in how the service is run. That we are proud of the successes and achievements of the service, that we want to improve the way things work in the service, and motivation has increased in the service over the last year. 4B's actual results within the satisfaction survey in the category of values and behaviour show that we listen and learn so that we can get better at the way we do things. We recognise and promote the value of high performance, and we go out of our way to support each other and help the people we serve. And some of you may be familiar with these charts that you get with the BPA survey. So we went from 2011 from a culture of reaction to a culture of success. The culture of success that we're in 2013 is defined as having more than 60% of the employees are engaged within the organisation, that large numbers of the employees are optimistic with the organisation's future. There is a strong sense of success and achievement, that things are getting better all the time. Employees are positive and proactive about tackling problems, and that there is a can-do mentality. This culture is very close-knit, very cohesive and very focused, so we're quite proud to be within that. And as Cheryl's sunning herself in Hawaii, she's left this quote with us today. I'm exceptionally proud of my team and the success we have shared with Essentials of Care methodology, achieving cultural change and developing patient-centred care. The experience of the Essentials of Care program has promoted teamwork, built on our ideas, putting them into practice for the advantage of surgical patients, of which we pride ourselves on the care we deliver. And I'll pass you now over to Mel.
One of the projects that we have embarked on 4B is on fluid balance charts. So we've titled this Anyone for a Drink. This is where we are now. No, it's not. Only joking. The staff on the surgical ward have embarked on improving our education and documentation of patient fluid balance charts. We were able to identify this as a need through EOC observation and audits. We identified these critical issues for the reason of why we took on this project. We discovered we had inconsistent methods with recording fluid balance charts, confusions of which patients should be on fluid balance charts, enabling patients to attend their own fluid balance recording, and patients not being commenced on fluid balance charts that should have been. From these critical issues, we have identified 3 domains of the essentials of care journey: documentation and communication, clinical monitoring, and promoting self-education. Documentation incorporated the provision of care of the patient on 4B, the treatment and management interventions, observation of the patient, assessment, diagnosis, clinical incidents, professional education and advice, and discharge planning. Promoting self-education. The staff on 4B have to individually assess patients as to whether they're capable and able to record their own fluid balance chart, and that it gives them a sense of empowerment. Calculated them. 4B has purchased equipment to endeavour on this project. We've purchased calculators for all of the nurses' stations, witches' hats to go in each of the bathrooms, and clear male urinal bottles so we can get accurate urine measures. Scales are located in the utility room so we can weigh incontinence aids, drainage bags, fecal loss, etc., so we can obtain a more accurate fluid measure. The EOC facilitators on 4B have put together several information and education sheets for the patients. They explained what is a fluid balance and why we record one, who uses the fluid balance chart and which patients will be put on a fluid balance chart, and empowering the patient to be responsible for their own fluid balance chart. The sheets also show which types of fluids we measure. The EOC facilitation team have also created education folders for both staff and patients, and we also place a laminated form in the patient bedside notes so that staff can easily identify who is on a fluid balance chart. How did we do? The ward is currently utilising our safe work practice on fluid balance management. Our audit results has shown our compliance have increased. Our most recent audit has shown that our compliance rates show 100% identification of patients requiring fluid balance charts and 100% of correct patients commenced on fluid balance charts. In March 2014, we can show a 22.2% compliance with the completion of a fluid balance chart, and this has increased from 14.3% from November last year. We will continue to work on this with education being provided. We are continuing to change the culture of our workplace with each project. Staff are now able to identify roles and are becoming involved in essentials of care projects, some without being even aware of it. Staff awareness of the importance of accurate fluid balance charts has increased. Please save your questions to ask our lovely Leah, one of Ward 4B's active EOC facilitators, who has had a very large input on this project. Thank you.